Have you ever stopped to wonder what you would do if a heart attack struck and there was absolutely no one around to help? It's a frightening scenario, one that none of us want to imagine, yet it happens far more often than we think. Many people assume they'll have time to react or that someone nearby will rush to their aid, but the truth is, most heart attacks strike suddenly and without warning. In those critical first minutes, every single action or hesitation can decide the outcome between life and death. The good news is that even if you live alone, spend long hours by yourself, or find yourself far from immediate help, survival is still within your reach. The key is knowing exactly what to do and how to stay calm when every instinct in your body tells you to panic. In this video, we'll walk through the essential steps you must take the very moment a heart attack begins and you're completely alone. These aren't complicated medical procedures. They're simple, practical, life-saving actions that anyone can do. We'll guide you through how to recognize the first warning signals, what you should take immediately, how to protect your heart from further stress, and which small yet powerful actions might give you just enough time for help to arrive. Stay with us until the end because the final steps are the ones people often overlook, and they could be the very ones that save your life. Let's begin with step 1: recognizing the earliest signs of a heart attack. When most people think of a heart attack, they picture something dramatic, someone clutching their chest, collapsing to the floor, gasping for air. But in reality, heart attacks rarely look like the movies. The body often whispers before it screams, and those whispers are your first and best opportunity to act before irreversible damage begins. Recognizing those subtle signs could be the single most important skill you ever learn. So, what do these early signals look and feel like? The classic symptom is a deep, heavy pressure in the center of your chest. It's not always a sharp pain, it's more like an uncomfortable squeezing or a weight pressing down on you. It might feel as if something heavy is sitting on your chest or as though the air around you has become thicker. The sensation can build gradually or come in short waves. Sometimes it fades away for a few moments and then returns, which makes many people assume it's nothing serious, perhaps just indigestion or muscle strain. That's where many go wrong. Beyond chest pressure, heart attacks often trigger other sensations throughout the body. You might feel pain, tightness, or numbness in one or both arms, especially the left. Some people experience an aching in the neck, jaw, back, or even upper stomach. For others, shortness of breath appears first, long before chest discomfort. You might find yourself panting after minimal activity or struggling to take a full breath even while sitting still. These symptoms can easily be mistaken for fatigue, anxiety, or acid reflux, but when combined, they form a clear warning that your heart is in trouble. Let's take an example. Imagine a man named Robert, 70 years old, sitting on his porch with his morning coffee. He begins to feel a strange tightness just below his collarbone, not exactly painful but uncomfortable. He brushes it off as heartburn and takes another sip. Minutes later, his breathing becomes shallow, and he starts to sweat despite the cool breeze. That's when something clicks. He remembers reading that not all heart attacks cause severe chest pain. Robert doesn't wait any longer. He calls emergency services immediately. That quick recognition and decision likely saved his life. It's important to remember that symptoms don't always follow a pattern. For older adults and especially women, the early signs can be much subtler. Instead of chest pressure, they might feel fatigue that won't go away, sudden dizziness, lightheadedness, or a sensation of heaviness in the upper back or shoulders. Some even describe it as a mild flu-like feeling or an upset stomach. Because these symptoms seem minor, many people delay seeking help, and that delay can cost them precious minutes they can't afford to lose. The heart is a master communicator if you know how to listen. It doesn't just announce an emergency with sharp pain, it gives you clues long before disaster strikes. For instance, you may notice that routine activities like climbing stairs or carrying groceries suddenly feel harder than usual. You might wake up unusually short of breath or find your heart racing without reason. These are not random sensations, they're your body's early alarms. So what should you do the moment something feels off? Stop whatever you're doing. Sit down or lean against something stable. Take a few slow breaths and pay attention to what your body is telling you. If the pressure, tightness, or breathlessness persists for more than a few minutes, do not ignore it. Don't tell yourself you'll wait to see if it passes. Don't convince yourself that it's stress or something you ate. The sooner you act, the greater your chance of surviving. Here's another real-world story that drives this home. Margaret, 65, was cooking dinner one evening when she felt what she thought was gas pain. It wasn't sharp, just a strange fullness in her chest. She decided to sit down and rest. A few minutes later, her arms began to tingle and she started sweating profusely. Instead of dismissing it, she remembered hearing that women's heart attack symptoms can differ from men's. She grabbed her phone, dialed 911, and calmly explained her symptoms. Paramedics later told her that her quick action prevented severe heart muscle damage. That's the power of recognition. It's your first defense, your warning shot. When your body starts whispering, listen carefully. You don't need to be a doctor to understand the signs. You just need awareness and presence of mind. Here are a few specific warning combinations to remember: pressure or heaviness in the chest that lasts more than 2 minutes or comes and goes repeatedly. Unexplained shortness of breath, even when sitting still. Sudden sweating, nausea or lightheadedness. Pain spreading to the arms, neck, jaw, or upper stomach, extreme fatigue, or a sense that something just isn't right. Even if you have only one or two of these, treat them seriously. The heart attack you prevent might be your own if you take nothing else from this first part. Take this: your heart will warn you, but only once. When it does, don't second guess it. Don't wait for the movie-style pain. Don't tell yourself you'll see how you feel in the morning. Those first minutes are your chance to take control of your survival. Recognizing the signs early isn't about fear, it's about empowerment, because once you know what to look for, you'll never again be caught completely off guard. You'll have the awareness to act quickly, calmly, and with purpose. In the next part, we'll talk about what to do immediately after you suspect a heart attack, the step that could quite literally save your life before anyone even reaches you. Stay with us, because the next action is the most urgent one you'll ever need to take. Once you realize that your symptoms might be the beginning of a heart attack, the next few minutes are absolutely critical. This is the point where your decisions directly influence whether you live or die. It's not an exaggeration, it's reality. The second you suspect that something serious is happening to your heart, your very next action must be one thing and one thing only: call emergency services immediately. This might sound obvious, but you'd be surprised how many people hesitate. Some think maybe it's not that bad, others don't want to bother the paramedics, and some convince themselves they can handle it alone or even drive themselves to the hospital. Unfortunately, those few minutes of doubt are often what separates survival from tragedy in a heart attack. Time is muscle. Every passing minute means more damage to your heart tissue. Acting fast isn't just smart, it's essential. Imagine your heart as an engine. When a blockage forms, it's like cutting off the fuel supply to a crucial part of that engine. The longer the blockage remains, the more that section burns out. Once that damage is done, there's no repairing it. That's why emergency help isn't just about transportation, it's about getting immediate life-saving treatment on the way to the hospital. When you call for help, trained emergency responders begin preparing for you before they even arrive. They'll bring oxygen, cardiac monitors, clot-busting medications, and the tools to restart your heart if it suddenly stops. Every second you wait before calling is a second lost in that chain of survival. Let's look at a real-life example. Linda, 76, was home alone when she began feeling an ache in her upper chest that spread to her left arm. She felt nauseous, started sweating, and thought about calling her son first, but then remembered advice she'd heard years ago: in a medical emergency, family can wait. Call 911 first. She followed that advice. The emergency team arrived in under 10 minutes, started treatment right there in her living room, and stabilized her heart before transporting her to the hospital. Her cardiologist later told her that calling first and calling fast made all the difference. That single decision, picking up the phone immediately, can mean everything. Now let's talk about why you should never try to drive yourself to the hospital. It's one of the most dangerous mistakes people make during a heart attack. Your heart's rhythm can suddenly become irregular. You could lose consciousness or control of your vehicle within seconds. Imagine blacking out behind the wheel. Not only would it endanger you but also everyone else on the road. Even if you think you're stable enough to make it, symptoms can intensify rapidly. It's simply not worth the risk. When you call emergency services, tell the dispatcher clearly that you think you might be having a heart attack. They are trained to handle panic and confusion. They'll ask questions to assess your condition, give you immediate instructions, and keep you calm until help arrives. If you're too weak to talk for long, give them the essentials: your name, address, and a brief description of what you're feeling: chest pain, shortness of breath, dizziness, or nausea. Then follow their directions carefully. If you live alone, it's wise to prepare for this scenario before it ever happens. Keep your phone charged and within reach, especially at night or when you're home alone. Most smartphones have an emergency call feature accessible from the lock screen. Learn how to use it. You can even set your phone so pressing the power button 5 times automatically dials emergency services. Those few seconds can make a huge difference. Now you might be wondering, what if I'm too weak to speak clearly? In that case, most modern phones can still send your location to emergency services automatically if you can leave the line open. Even if you can't respond, dispatchers can often track your location and send help based on background noise or breathing patterns. Don't hang up, stay on the line until they tell you otherwise. Let's consider another example. George, 68, was watching TV one evening when he started feeling pressure in his chest and jaw. Instead of ignoring it, he used his phone's voice assistant to dial emergency services hands-free. Within minutes, he was connected to a dispatcher who guided him through what to do next: sit down, stay still, and unlock his front door. By the time paramedics arrived, he was pale but conscious, and they immediately began administering oxygen and preparing an ECG. Later, doctors confirmed that if he had waited even 15 minutes longer, his outcome could have been drastically worse. Stories like George's and Linda's show that helping yourself starts with asking for help. It's human nature to underestimate emergencies, especially when you don't want to seem dramatic. But when it comes to heart attacks, overreacting is the right reaction. If it turns out to be something less serious, no one will judge you. Emergency responders deal with false alarms every day. They'd rather arrive and find you safe than be too late to save you. When you make that call, take a deep breath and focus on staying calm. Panic makes your heart work harder, which can worsen your condition. Listen to the dispatcher's voice. They'll walk you through each step, keeping you focused until the ambulance arrives. If you live in an apartment building or gated community, it's also smart to tell the dispatcher any special access instructions like a gate code, apartment number, or how to find your entrance. That way, the emergency team can reach you faster without wasting precious time. Preparation before an emergency can make your reaction almost automatic. Here are a few things to do in advance. Keep a list of emergency contacts somewhere visible on the fridge, near your bed, or saved in your phone. Write down your address clearly, especially if you live in a rural area or new housing complex where GPS may be inaccurate. Tell a close neighbor or friend that if they ever hear your alarm or you call for help, they should check and immediately store any important medical information, like heart conditions, allergies, or current medications, in an easy-to-find place. These small actions don't seem urgent until the day they suddenly are. When you've already prepared, your mind doesn't waste energy on what to do next. You simply act, and that action can save your life. Let's revisit a key point: every minute counts. The longer your heart is deprived of oxygen, the more heart muscle dies. Within 5 to 10 minutes, the risk of cardiac arrest where the heart completely stops rises sharply, but calling for help triggers a chain reaction that mobilizes trained professionals, specialized treatment, and the possibility of life-saving intervention before your heart gives out. Remember this mantra: don't wait, don't drive. Just call. You don't need to be certain it's a heart attack to make that call. You only need to suspect it. Let the experts decide. The cost of a false alarm is nothing compared to the cost of hesitation. If you're still watching this and finding this information helpful, leave a comment with the number 2 to show that you're here and learning. And if you haven't already, make sure to subscribe and turn on notifications so you never miss a video that could one day save your life. In the next part, we'll cover something surprisingly simple yet powerful enough to improve your chances of survival dramatically while waiting for help to arrive. It's something you probably already have in your home: a single tablet of aspirin. When you've recognized the warning signs and called for emergency help, your next step can literally buy you extra minutes of life. Chewing an aspirin. This might sound like a small thing, but it's one of the most powerful self-help actions you can take while waiting for medical professionals to arrive. Let's understand why. A heart attack happens when a blood clot blocks one of the arteries that supply oxygen to your heart. Without that flow, part of your heart muscle begins to die. Aspirin works by preventing platelets, the tiny cells that help your blood clot, from sticking together. In simple terms, it helps slow or stop the growth of the blockage, allowing at least a trickle of blood to continue reaching your heart. That can make a life-saving difference. But here's the critical part: you must chew the aspirin, not just swallow it. Chewing allows the medicine to enter your bloodstream much faster through the tissues in your mouth. Swallowing a whole pill can delay its effect by several minutes, and in a heart attack, every second matters. If you can take one regular strength tablet, usually 325 milligrams, chew it thoroughly and swallow it with a sip of water. If all you have is low-dose aspirin, 81 milligrams baby aspirin, take 4 of those. Of course, there are a few exceptions. If you know you're allergic to aspirin, have been told by a doctor not to take it, or are already on blood-thinning medication, do not take it without medical advice. But if you've never had such warnings and your symptoms strongly suggest a heart attack, chewing aspirin is almost always the right move. Let's look at an example. Daniel, a 59-year-old teacher, began feeling tightness in his chest after dinner. He broke out in a sweat and remembered reading that aspirin could help during a heart attack. He quickly dialed emergency services, explained his symptoms, and was told to chew an aspirin while waiting. He did, and by the time paramedics arrived, the aspirin had already begun reducing the severity of his blockage. Later, his cardiologist told him that action likely saved precious heart muscle tissue. Now, let's clear up a few common misunderstandings about aspirin. Some people think they should take more than one regular strength pill for a stronger effect. That's not true and can actually be dangerous. One 325 milligrams tablet is enough. Taking more won't speed up the benefit but could increase the risk of bleeding. Others assume they should crush it into water or mix it with food. Again, not necessary. Simply chew it well and let it absorb naturally. If you take aspirin daily for another medical reason like preventing strokes or treating chronic heart disease, you might wonder if you should skip this step. The answer: don't skip it. Even if you've already taken your usual daily dose, chewing one more tablet during a suspected heart attack is standard emergency advice because of how quickly it works in that critical moment. Here's something else that's important. Don't waste time searching for a specific brand or coating. Some aspirin tablets are labeled enteric coated, meaning they're designed to dissolve slowly in your stomach. That kind takes longer to work, but if that's all you have, chew it anyway. The goal isn't comfort, it's speed. While you're taking the aspirin, make sure you're sitting down and staying as still as possible. Movement makes your heart work harder, which can worsen the blockage. Find a comfortable position, preferably upright, with your back supported, and focus on slow, steady breathing. Your priority right now is minimizing strain on your heart. If you're near your phone, keep the emergency line open while doing this. The dispatcher might ask you if you've taken any medication. Tell them clearly that you've chewed an aspirin so the paramedics know before they arrive. It helps them plan your treatment more effectively. Let's imagine another scenario. Martha, 64, lived alone and had experienced occasional chest discomfort before. One evening, While cleaning the kitchen, she suddenly felt sharp pain radiating to her left shoulder. She recognized the signs immediately, called for help, and sat down near her front door. Then she remembered the advice her doctor once gave her: always keep aspirin within reach. She kept a small bottle in her living room drawer. Martha quickly chewed one tablet and waited calmly while breathing slowly. When the paramedics arrived 12 minutes later, she was alert and stable enough for early treatment, all because she knew what to do. It's these few minutes between calling emergency services and their arrival that often determine survival. Aspirin is your ally in those moments. It's simple, affordable, and available almost everywhere, but only if you prepare in advance. That's why experts recommend keeping aspirin in easy-to-reach places: in your bedside drawer, in your kitchen or living room, in your car's glove compartment, even in your wallet or purse. The goal is to make it effortless to access, especially if your symptoms hit suddenly. You might only have one hand free or be too weak to move far, so having it nearby can make all the difference. Finally, remember this: aspirin doesn't cure a heart attack, it buys you time until professional help arrives. Don't assume that taking it means you're out of danger or can skip calling for help. Always treat it as a first step, not the last. In the next part, we'll talk about how to protect your heart while waiting for help to arrive, including the right way to rest, position yourself, and manage your breathing so you don't worsen your condition before rescue teams reach you. Once you've chewed an aspirin and called for emergency help, your next priority is to protect your heart while waiting. This is the stage where many people unknowingly make their situation worse by trying to move around, pacing nervously, or attempting to walk it off. But what your heart needs most right now is calm and stillness. Here's why. When you move even slightly, your heart has to pump faster to supply oxygen to your muscles. But during a heart attack, part of your heart's blood supply is already blocked. Forcing it to work harder increases the strain, expanding the damage zone. By staying still, you minimize your heart's oxygen demand and give yourself the best chance to survive until professional help arrives. So, sit down or lie back, whichever feels more comfortable, and try to keep your upper body slightly elevated. This helps your breathing and prevents blood from pooling in your lungs. A good position is to sit upright on the floor against a wall or piece of furniture, with your knees bent. If lying down feels better, lie on your back with your head and shoulders slightly raised using a pillow. Avoid lying completely flat, as that can make it harder to breathe if you're short of breath. Also avoid sudden movements, no standing up quickly, walking, or reaching far for items. If something important, like your phone or medication, is out of reach, try to drag it toward you slowly, or use your foot or another object to pull it closer rather than standing up. Now, let's talk about breathing, because it plays a huge role in keeping your heart stable. During a heart attack, panic can make you breathe too fast, which lowers carbon dioxide in your blood and can make you dizzy. Try slow, controlled breathing instead. Inhale through your nose for 4 seconds, hold for 1 second. Then exhale gently through your mouth for 5 seconds. This steady rhythm can help you stay conscious and reduce anxiety. Let's take a real example. Samir, a 61-year-old shopkeeper, began feeling crushing pain in his chest while at home. He immediately recognized the signs, called emergency services, and chewed an aspirin. While waiting, he resisted the urge to pace or call family members repeatedly. Instead, he sat down near his front door, leaned back against the wall, and focused on steady breathing. When the paramedics arrived, they found his heart rate steady and oxygen levels decent, something that might not have been the case if he had been moving around or panicking. Another vital thing: don't eat or drink anything except your aspirin. Even though you might feel thirsty or want to calm yourself with water or food, swallowing anything else can interfere with medical treatment. Once paramedics arrive, if emergency personnel decide to give you anesthesia or medication later, having food or drink in your stomach can increase the risk of complications. So, keep your mouth clear after chewing aspirin. Now, if you're wearing tight or restrictive clothing, especially around your chest or waist, loosen it slightly. That can make breathing easier and reduce discomfort. But don't waste time changing clothes or standing up. Just loosen your belt, tie, or top button while staying seated. If you've called for help and are waiting alone, it's smart to position yourself near an unlocked door if you can safely do so. This makes it easier for paramedics to reach you if you lose consciousness. Many people die simply because rescuers can't access their home fast enough. So if you can move slowly and without strain, unlock your main door, then return to your resting position. Let's talk about what not to do while waiting. Don't try to drive. Don't call or text multiple people. One emergency contact is enough. Don't take any other painkillers, like ibuprofen or acetaminophen. They don't help a heart attack and can interfere with treatment. Don't ignore new symptoms. If your chest pain worsens, tell the emergency operator immediately. If you start to feel faint, dizzy, or like you might pass out, try to stay conscious at all costs. Losing consciousness can stop your breathing pattern and make resuscitation harder. Focus on small, calm breaths, and keep reminding yourself that help is already on the way. Here's a mental trick that can really help. Imagine each breath as a wave calming your heartbeat. Count them silently, 1 in, 1 out, and visualize your heart getting a little stronger with each cycle. It may sound simple, but controlled breathing helps regulate your body's stress response and keeps your blood pressure more stable. Another thing to consider: if you have pets or children around, try to secure them safely. Close pets in another room so they don't disturb you or block rescuers. If children are home, tell them calmly that you're not feeling well and that help is coming. Avoid panicking them, as their distress might increase yours if you have a medical ID bracelet or any written record of your conditions. Place it somewhere visible, maybe on your chest or beside you. That can give paramedics immediate, crucial information about allergies or medications. Some people also keep a medical info card in their wallet or on their phone's lock screen, a small but powerful tool in emergencies. The biggest challenge during these moments is fear. You'll likely feel waves of panic, uncertainty, and the instinct to move. But remember, every second you remain calm and still, you're giving your heart a chance to hold on. Think of stillness as your shield. The quieter you stay, the less oxygen your heart needs, and the higher your odds of survival. By staying still, breathing slowly, and keeping your surroundings ready for rescuers, you're not helpless, you're fighting smart. In the next part, we'll cover how to prepare your environment for rescue and communicate effectively with paramedics, including what to say, what to show them, and how to ensure they can start life-saving treatment the instant they arrive. By this point, you've recognized the symptoms, called for help, chewed an aspirin, and positioned yourself safely while resting. Now comes the final and equally crucial part of surviving a heart attack alone: preparing for rescue and communicating clearly with emergency responders. These last steps ensure that when help arrives, the paramedics can start treatment immediately without delay or confusion. When you're waiting for medical professionals to arrive, every second of preparation matters. Many lives are lost not because paramedics arrive late, but because they can't reach the patient quickly, or waste valuable time figuring out what happened. Let's make sure that doesn't happen to you. Step 1. Make it easy for rescuers to reach you. If you haven't already done so, unlock your main door, leave it slightly open if it's safe to do so. If you live in an apartment, alert your building's security or a neighbor by phone that help is on the way, so they can direct paramedics to your unit. Don't worry about politeness, noise, or privacy. Focus on saving time. Tape a note on the door if you can. Emergency inside heart attack. Door unlocked. If you're in a large house or complex, try to position yourself somewhere visible or close to the entrance. Don't hide in a back room or upstairs if you can help it. You want rescuers to find you quickly without searching the entire home. Step 2. Gather vital medical information. If you're conscious and able, collect or write down key details. Your name and age. Any medications you take regularly, known allergies, especially to aspirin, penicillin, or anesthesia. Any chronic conditions like diabetes, high blood pressure, or prior heart issues. Place that note beside you or on your chest. You can also put your ID and medical card nearby. If you wear a smartwatch or have a smartphone, activate the medical ID feature. Paramedics can access it even if your phone is locked. This one small detail can give them an instant head start on treatment. Step 3. Keep your phone line open. If you're speaking to the emergency operator, don't hang up unless they tell you to. They might give you real-time instructions based on your symptoms. Keep them updated if you feel worse. For example, if the pain spreads, you become dizzy, or you start to lose strength on one side of your body, these updates can alert paramedics to prepare specific treatments before they arrive. If you feel your condition changing, like an increase in chest pressure, new pain in your arms or jaw, or nausea, say it out loud to the operator. Speaking helps you stay conscious and aware, and also gives them more data about what's happening inside your body. Step 4. Stay calm and cooperate. When the paramedics arrive, they'll likely ask a few quick questions before anything else. Try to answer with short, direct words. Chest pain started 10 minutes ago. I chewed 1 aspirin. I'm allergic to penicillin. This helps them decide which medications to give and which to avoid. They'll likely check your pulse, blood pressure, and oxygen level immediately. Trust their process even if it feels slow. It's systematic and designed to protect you. If you're wearing a watch, necklace, or tight clothing around your chest, they may remove it quickly. Don't resist. They need clear access to attach monitors or defibrillator pads. If your heart rhythm needs support. Step 5. Inform them of any recent events or triggers. Tell them what you were doing before the pain began: eating, walking, lifting something heavy, or experiencing stress. Even minor details help doctors later trace the cause and decide whether it's a blockage, muscle spasm, or another cardiac issue. Also, let them know if you've taken any medications recently, even over-the-counter painkillers or supplements. Mixing certain drugs can interfere with emergency treatments like nitroglycerin or clot-busting injections. Step 6. Mentally prepare yourself for transport. Once the paramedics are ready to move you, stay relaxed and let them handle the physical work. They'll often put you on a stretcher and connect oxygen tubes or 4 lines on the way to the ambulance. Try not to talk too much or move your arms. Save your strength. Your focus now is simple: keep breathing slowly and stay aware. If you're able to call or text one trusted contact before leaving, send a short message like "ambulance taking me to the hospital. Chest pain. I'm okay." That helps avoid panic and ensures someone can meet you at the hospital with your medical records or personal items. Step 7. Trust the professionals. Once you're in the ambulance, trained medical staff will take over completely. They'll monitor your heart rhythm, give oxygen or medication, and prepare the hospital team for your arrival. Remember, you've already done the hardest part. You recognized the signs, acted fast, stayed calm, and gave them the information they needed. Now it's their job to finish what you started. Let's take one more real example. Rahim, a 58-year-old office worker, was home alone when severe chest pressure struck him. He called for help, chewed an aspirin, unlocked his front door, and stayed seated. When paramedics arrived, they found a note with his medications and ID beside him. That small act saved almost 10 minutes of questioning and searching time that was instead spent stabilizing his heart on the way to the hospital. His doctor later said that preparation gave us a head start. It probably saved his life in a heart attack. Survival depends on 3 things: speed, calmness, and clarity. You can't control the blockage, but you can control how you respond. Every step from recognizing symptoms, calling emergency services, chewing aspirin, staying still, to preparing for rescue is a chain of life-saving actions. Break one and your chances drop. Follow them all, and you give yourself the best possible shot. In conclusion, remember this: heart attacks rarely give warnings. But with awareness, preparation, and calm action, you can survive even when you're completely alone. Keep aspirin nearby. Learn the symptoms. Practice how to stay still and breathe through panic. And most importantly, never ignore your body when it's trying to tell you something. Your quick thinking and preparation could make the difference between life and loss, not just for you, but for the people who love you. Stay informed, stay calm, and stay alive.